Welcome to Chapter 28, Hematologic and Renal Emergencies. Blood, the hematologic system. Uh, it represents its own organ system. It has specific functions such as controlling bleeding by clotting, delivery of oxygen to cells, removal of CO2 from cells, and removal and delivery of other waste products to organs that filtrate them and remove them. It is made up of solid components such as red blood cells, white blood cells, platelets, and it is suspended in plasma. Medications can affect some components of the blood. Blood clotting. So, aggregation of platelets is the body's most rapid and initial response to stop bleeding. Clotting factors are a group of proteins produced in the liver and released into the bloodstream. Once activated, those clotting factors form clots through clotting cascades. This is the clotting cascade. So just be aware, you're not going to be tested on this. You're not going to just information, okay? So there's an intrinsic pathway and an extrinsic pathway for clotting. The intrinsic pathway will start with some type of damaged surface, and it will go through all of the clotting factors and ultimately end up with some type of clot formed. An extrinsic pathway is caused by some outside force, like trauma, and it will go through the clotting factors to produce what it needs to produce to clot that bleed. Coagulopathies, this is abnormal clotting of the blood. It can occur when the body forms clots too readily or the patient clots too slowly. Certain diseases make patients prone to poor clotting, such as advanced liver disease, hemophilia, and von Willebrand disease. So basically what happens is in coagulopathies is that some clotting factor is deformed or impaired. So those clotting factors that I showed you in the previous slide, one of those will be an issue. So like typical one is factor 8, where you can't produce the clotting factors that you need to stop a bleed. Okay, so we're going to identify these patients. So certain medical conditions in which the normal ability to form the clot can worsen the patient's disease, and they may be on blood thinners. When they're on blood thinners, they are more prone to life-threatening bleeding when injured than patients not on these medications. So if a patient falls and they hit their head, and they're an older patient, they're on a blood thinner, it is important to know that they are on a blood thinner because they could have a head bleed. So care for these patients, standard precautions, perform a primary assessment, care for any kind of life threats, obtain a history, and identify which specific blood thinning medication they're taking or which bleeding disorder they suffer from, and notify the hospital as soon as possible. Monitor the patient for development of signs and symptoms of shock, decreased mental status, administer O2 if the patient appears to be in shock, transport to an appropriate receiving facility. Anemia, this is a lack of normal amount of red blood cells in circulation. Acute anemia is sudden blood loss. Chronic anemia is a recurrent heavy menstrual periods, slow GI bleeds, or diseases affecting bone marrow or the structure of hemoglobin. Sickle cell anemia, this is a genetic disease affecting red blood cells. This occurs in patients of African descent, and it basically deforms the red blood cell shape. and it makes it look like a sickle cell, or like a sickle, like cutting grass, or like the Grim Reaper. Cells have a short lifespan, leading to chronic anemia as well. When this occurs, I think we'll talk about it, but when this occurs, it is painful. So it can cause destruction of the spleen, a sickle cell pain crisis, acute chest syndrome, priapism, stroke, and jaundice. Um, like I said, it is painful when it does occur, because basically um, those deformed red blood cells get into a spot where they can't move, and so they just kind of block the nerve pathways and stuff like that in the vessels. It is estimated that 1 in 13 African Americans has sickle cell trait. The sickle cell trait does not always lead to complications. They can lead a normal life with it. Administer oxygen if needed, monitor for inadequate respirations, monitor for signs of hyperperfusion, and transport to a stroke center if a stroke is suspected. The renal system. So there's a couple different components in the renal system. We have the kidneys, the ureters, and the urethra. Kidneys are essential for life. They filter blood and remove waste products, excessive salts, and excessive fluid, and it helps to maintain our fluid balance. So diseases, they affect many different portions, and they range from minor to life-threatening. UTIs, these are the most common that afflicts the renal and urinary system. It is caused by some bacteria. It's usually limited to the bladder. It can cause pain and frequent urination. If left untreated, can result in pyelonephritis, where the UTI ascends up into the ureter, into the kidney, and cause kidney stones. Kidney stones. These are usually made of calcium and formed within the kidney. When in the kidney, they usually cause no symptoms. It's when they become dislodged. They can cause severe unilateral joint pain, and the patient reports nausea and vomiting. Urinary catheters. So the need for a urinary catheter can cause is for like an obstruction of bladder outflow or neurological disorder, such as cerebral palsy, or various other like genetic neurological disorders. These patients use urinary catheters to drain urine, commonly inserted into the urethra and maybe placed through the skin as well. Complications include UTIs and local trauma. There's an indwelling, and then there's a straight cath right here. The straight cath is just a one-time, I feel the urge to go to the bathroom, so I'm going to go to the bathroom, and I'm going to straight cath. Renal failure occurs when the kidneys lose the ability to adequately filter and remove toxins. Acute failure typically occurs from shock or toxic ingestion. Chronic failure may be inherited or secondary to damage from uncontrolled diabetes or hypertension. End-stage renal disease. This is an irreversible renal failure. It requires dialysis, either hemodialysis or peritoneal dialysis, and 90% of these patients receive hemodialysis in specialized centers. The vast majority of these patients, 450,000 patients, is on dialysis, treated in dialysis centers. They undergo 3 treatments a week, each lasting 3 to 4 hours. They are either on a Monday, Wednesday, Friday schedule or a Tuesday, Thursday, Saturday schedule, depending on where they're at. Only 8% of these patients treat themselves at home, and ESRD patients often rely on EMS transport to and from dialysis. We do not do a lot of dialysis transports up here in this area. I think there's a service that actually does it. But when you get into the larger cities, that's what they do, is dialysis treatments. They have whole services dedicated to dialysis transfers. Hemodialysis, this is when a patient is connected to a dialysis machine that pumps blood through specialized filters. There's two large catheters that create a circuit by which the blood is removed from the body, filtered, and then returned to the body over several hours. There's two types of access. You can do a 2-port catheter or an AV fistula, and it has the characteristic thrill when palpated. So the picture on the left is the 2-port catheter. The picture on the right is a AV fistula, and it's just accessed by the techs and nurses at the center. Peritoneal dialysis, this uses peritoneal cavity's large surface area. It is a specialized fluid that's infused into the abdominal cavity and left for several hours to absorb the waste and excess fluid, and then that fluid is removed and discarded. Typically, peritoneal dialysis is done at home, and it's done overnight. Continuous ambulatory peritoneal dialysis is a gravity exchange process repeated several times a day, and then there's also a continuous cycler assisted peritoneal dialysis, which is where they use a machine, and basically what happens is that machine warms it up and shakes it and goes in. So, medical emergencies. So they can be divided up into two groups. They can be either loss of normal kidney function or complications from the dialysis treatments. The vast majority of dialysis patients have other underlying diseases such as diabetes and high blood pressure. It usually will relate to the patient missing dialysis. Patients with signs and symptoms similar to congestive heart failure, so they're going to have shortness of breath, edema, and electrolyte disturbances. Good questions, good assessment questions to ask these patients is when your last treatment was, how much did they take off, or how much did you weigh, and at the beginning and at the end, and then yeah, all those questions. Okay, so care for these patients: ABCs, position of comfort, administer O2, consider CPAP if needed. You may also have to have your AED ready for a critically ill patient, and then, if possible, transport to a facility capable of dialysis, which most hospitals have in-hospital dialysis. So complications, they can have bleeding from the AV fistula site, they can have clotting and loss of function of the AV fistula site, bacterial infection of blood due to contamination of the fistula or site, and it can cause peritonitis if it's like a peritoneal dialysis. Bleeding from the AV fistula site, your staff is very well trained at the center to deal with bleeding from the AV fistula site, and they're going to be hopefully on top of it and all of those things, so that way they don't necessarily have to call us, but occasionally it does happen. So ABCs: controlled bleeding, direct pressure, elevation, hemostatic dressings, tourniquets, and administer O2. Treat for shock, and if peritonitis is suspected, transport to dialysis fluid for confirmation. Kidneys are the most commonly transplanted organs. You can live with one kidney. There are approximately 21,000 transplants per year. Patients spend their lives on the special class of drugs to help prevent organ rejection and increased susceptibility to infections as well. So, if you have any questions, let me know, and I will answer those to the best of my ability.